Another patient presented with a vitreous prolapse and retinal detachment. And another patient who came with, presented with aphakia, we were suspecting a posterior dislocation, and on USG-B scan, the crystalline lens was found in the vitreous. Preoperative management, all patients were treated with topical steroids and anti-glaucoma drops, and pupilloplasty was done following subsidence of acute inflammation. A patient with Berlin's edema was preoperatively treated with nepafenac and prednisolone, which resolved 2 months later. Another patient underwent SICS with PCOL first, followed by SFT 1 month later. 2 of the cases could not be operated, one with the retinal detachment and the Purshaw's retinopathy. The surgical technique, there's a proximal and a distal clear corneal incision. A straight round-bodied needle with 9-0 or 10-0 Prolene suture is passed through the proximal flap of the iris, which is held with the help of micro forceps, and the 26 gauge needle using a railroad technique holds the round body needle and pulls it through the distal distal incision. The Sinskey hook was used to create a loop from the distal end of the distal part of the suture, and the proximal end of the suture was cut, and the end was passed 4 times through the loop, and the knot was slided into the anterior chamber and gently pulled, and both the ends were gently pulled, and the ends were cut. Post-operative findings, all patients showed improvement in BCVA except one patient who showed signs of persistent cystoid macular edema post-op, and another patient showed extremely high IOP because of severe iritis, and further that patient developed open-angle glaucoma, secondary open-angle glaucoma, which was managed conservatively with eye drop prednisolone hourly and eye drop brimonidine and timolol. So, coming to the take-home message, the advantages of single pass flow through pupilloplasty include shorter duration of surgery, minimal number of times the microhook is passed through the AC, which leads to lower risk of infection, and minimized corneal endothelial cell loss and lower chances of knot slippage. Clinical implications of pupilloplasty are improved visual function, enhanced light sensitivity, corrected anisocoria, and enhanced cosmetic outcome, and treatment of a traumatic pupil. That's all. Thank you.
Very good, madam. Did you consider, because most important aspect in the trauma is the comorbidity?
Yes,
because
sir.
there are damage to multiple structures.
Yes, sir.
So when you have retinal detachment, when you have other conditions,
yes,
those will impact on visual outcome, right?
Yes,
so that variable we have not considered in the study.
Yes, sir. Sir, actually we only took those cases who present with only ocular trauma, no other...
Yeah, but ocular trauma can impact the lens, can impact the zonule, can impact the
yes,
angle. So all these
yes,
pathologies also will impact the visual outcome.
Yes, sir. Yes, sir.
So those factors are not considered as a variable in the study. That's what is my question.
Yes.
Or did you have any mechanism to eliminate that confounding factor?
Yes, sir. There was one patient who presented with anterior subluxation of the lens, and that patient underwent pupilloplasty along with PPV and IOL implantation. Right. So that was a combined surgery done for that particular
patient. Obviously, but that patient and simple patient with traumatic cataract cannot have the same outcome.
Yes.
So when we are comparing that.
Yes,
right.
sir.
Thank you.
Thank you, sir.
Okay, thank you.